Hi, Dr. Habib. Many of the clients that we have explain how when they go for their annual physical, year after year, the findings are normal. But by the time they get the disease, the doctor says it's early. Well, really, is it early? What we understand about physicals is that by the time you get the disease, maybe up to 40% of your function has come down. Let me give you some examples. When people come with diabetes, they say that by the time you have the elevated sugar, up to 40% of your insulin reserve has depleted. The point about going for a physical is that by the time you get the disease, it's way downstream. For example, when you get a stress test, you have to have greater than a 90% blockage in your coronary arteries to have a positive test. So walking away from an annual physical with a normal result doesn't really give you the satisfaction, because by the time they diagnose it, they tell the patient it's early, but really they have weighted way down, like more than 90% blockage, or insulin reserves that's less than 40%, or cancer that they say is stage 1 and 2. The problem is billions of cells have already formed within the body. So at Next Health, we developed the executive physical. The Next Health executive physical takes away the mystery, takes away the problem of not being able to predict these problems. So the advanced evaluation starts off with a brain scan. The brain looks at the quality of the function of the brain speed, the actual voltage, as well as the physical reaction time. Because a healthy brain means that you can be sharp, have a good memory, have focus. Conversely, when people have depression, anxiety, insomnia, or worse still, any neurological problems, they have low voltage, they have low blood flow. Beyond that, we do what we call the biological age. The gold standard now in the 21st century is the epigenetic age. We can actually tell you how old you are based on the methylation pattern on your DNA. In animals, like a dog, we can tell within 6 months when the dog will die based on their epigenetic age. So why do we want to know the epigenetic age? Not because we want to know that you're going to die. What we want to know is that the more biologically young you are, the more likely you can prevent diseases like diabetes, heart disease, osteoporosis, dementia. You have to stay biologically young. So how do we know if you're biologically if you don't measure it? In addition to that, for some people, the genetics is really, really important. The genetics allows us to understand how to predict problems, or in the face of a problem, which one's going to be difficult. The genetics gives us an understanding of where the problems are, but we can figure out a way around them. That's the definition of an executive physical, to be able to predict things, to be able to prevent them, and when there's a problem, to know how to get around them. So merely controlling a disease, which is apparently the standard, is not good enough by the Next Health standard. The Next Health standard is to be able to not only predict, prevent it, but be able to reverse many diseases by engaging everything from your epigenetic age to your DNA, to understand your micronutrient levels, to understand your advanced cardiac levels, and many, many, many things which are contributing to diseases like inflammation, like oxidation, like insulin resistance. These are the real root of brain problems, of having cardiac problems, having joint problems, bowel problems, all these inflammatory conditions, which are millions of people have them, like inflammatory bowel disease, lupus, psoriasis. These are common. Up to 1/3 of the population have some kind of autoimmune disease, and another third have what we call dysfunction. Those are the people where they go to the doctor and the doctor says you're normal, but they don't feel normal. By the time you have disease, you've waited too long, by my standard at least, then they just put you on medicine which controls disease. At Next Health, we're about evaluating the whole picture, trying to prevent it where possible. Should you have the disease, we should be able to reverse the blood pressure. We should be able to reverse the cardiac blockages. We should be able to reduce inflammation. We should be able to eliminate fatty liver. What I was trying to say here is we can actually detoxify the liver. These are the components of the Next Health Executive Physical. From that, we can then formulate a plan to make improvements, and that is also included in the Executive Physical. At the end of the program, we will recheck the blood pressure coming down. We will recheck if the liver enzymes have improved. We will recheck if the vitamin levels have gone up. So not only do people get a good bird's eye view of all the different parts of their puzzle, we actually put together a program and we let them experience the physical benefits and show them the numbers to prove it. That's why a lot of people after the physical ask us, look, what else can I do to maintain it? So we have developed the Ultra program. That's our flagship, which is all inclusive. Whether you have disease that we want to reverse or you just want to stay biologically young. By incorporating these Ultra program, which is an all-inclusive therapy as well as vitamins, as well as monitoring, we can control the direction of whatever it is that you need. Preventing disease, staying biologically younger, or just being healthy. If you'd like to learn more, then contact us at 703-724-4000.